the first vaccination given is obviously a sign of hope. But the record number of cases today and the 300,000 death milestone is a reminder that we're still in the middle of what will be a very, very, very dark winter. There are, literally probably tens of thousands of deaths left before the end of the year, and more deaths after that. And the saddest thing at all, Rachel, is while we're waiting for this vaccine to be deployed, manufactured, distributed, there are simple things we could do now that would radically change the course of this virus. All Americans could wear masks. We could socially distance. We could wash our hands. We could do the things we need to do to bring this virus under control. The vaccine is hope. The vaccine is the endpoint. But full vaccination of the country is still months and months away. And it's in our hands, and in the hands of the government in Washington, our leaders around the country, to save lives between now and then.
President-elect Biden has talked about sort of the coming crimps in the process, that he expects that there may be supply issues in coming months, in part because the Trump White House turned down the opportunity to get more doses than we're getting. Yeah. He also talked about the fact that if Congress doesn't act to fund vaccination efforts, we're not actually funded for very long to carry out vaccination efforts around the country. Is it clear to you what the sort of decision points are, where we need to do policy things, legislation things, funding things in order to make this work as well as it can?
Yeah, Rachel, I think it's pretty clear what needs to happen. First of all, Congress needs to act this month to fund the vaccination effort that's going to unfold next year. The president likes to talk about the fact that we've bought a lot of vaccine, and that is a good thing. But we don't have enough vaccine yet to cover all the American people. And more importantly, we don't have the funding we need, probably as soon as February or March, to actually vaccinate people. Owning the vaccine is one thing, but getting it to people is an entirely different challenge. It has to be transported. It has to be distributed. Medical workers have to administer it to people. And we need special efforts to reach people in urban areas and in rural areas and places that aren't covered very well by the existing healthcare system. We need special outreach workers to get the vaccine to people. There's a lot of work to be done. Our transition team is busy planning that work that will start after January 20th, but Congress needs to fund it even now before Joe Biden takes office.